Thank you very much, Ms. Venus Wells, and I would echo your sentiments. I appreciate you all responding with unanimity and being able to be a part of this today. What compels us to be here today is we made a commitment in the structuring of our plans that we would allow the public preferably 2 weeks notice, but certainly we committed to 5 calendar days of notice before we changed any plan. As you all know, and you all approved, our plan is aligned to the DHEC frameworks. It's constructed that way initially. And as you recall, it aligns between DHEC's rating of high, medium, and low as far as spread. Now, when we developed this framework, there were several things we knew and there were several things we didn't know. One thing we knew when we developed the framework, that we were in a period of increasing spread as defined by DHEC. In fact, when the framework was developed, we were between 400 and 500 per 100,000 cases. When we announced it to the public, we were right at 500. I believe we were at 533. Now, although we are still rated at a high level by DHEC, the numbers are not as high as they were when we designed the plan. And I also mentioned to you there were things we did not know. What we did not know at that point, because we'd had no opportunity to know this, not having students in school, we did not know how well students, parents would adapt to and comply with the protocols in place. We did not know how well or how easily or how difficult it might be for our employees to not only follow the protocols they had in place, but to ensure that our students were following the protocols. Because it's a very different environment for employees and for students as well. All based on those 4 tenets of what public health and medical professionals tell us are the keys to combating this virus. And that is frequently washing or sanitizing your hands, wearing a mask, maintaining 6 feet of social distancing, and not being at work or at school if you don't feel well. One thing before we leave that, probably a good reminder, I don't think everybody always catches the nuance of wearing a mask. Wearing a mask in accord with public health information that we've received from DHEC does not alleviate your responsibility or need to stay 6 feet away from other people. Because the current DHEC guidance that has been in place since we designed this is whether you have a mask on or not, if you have been within 6 feet of proximity, inside 6 feet, with a person who is infected or tested or test positive, and you've been inside that 6 feet for 15 minutes or more, you're required to quarantine. So simply the fact that you had on a mask, if you stayed inside that 6 feet for 15 minutes or more, would cause you to have to quarantine. And quarantine is 14 days from the period of last contact when that contact was 15 minutes or more. Which presents a concern not only for the health and safety of our employees, our students, it also presents a concern about our ability, notwithstanding the consideration to their health, to be able to staff our classrooms. So the 6 feet, in accord with the public health information that we've received from the state's public health agency, 6 feet is key, and that drives a lot of what we do. We've now had 3 full weeks of school in addition to the leap week. You all recall the leap week was for students at the elementary and middle school level. We were required to offer it. It was required to be in person, but students were not required or compelled to attend. So at the elementary level and the middle school level, they had the leap week and 3 more weeks to carry out the protocols we have in place. At the high school level, had 3 weeks. We started with a 1, so with 1/4 of our brick and mortar students in attendance. We realized that we could move very quickly from a 1 to a 2. Now at the time we did that, we moved into a medium spread in the district, in the county. But we moved quickly to a 2 because of how well the 1 had gone. It went well because our students, our parents, and our employees did what they were asked to do. And they did it with great fidelity. It went very well. We believe that success, which is reflected in our numbers, and I'll share with you in just a minute the most up-to-date numbers of individuals we have in isolation and quarantine, in addition to our own contact tracing. We believe that that's a reason that our rate related to school has stayed extremely low. And it's remained stable during all those phases of attendance. So we're now at the point that we request that this body approve flexibility for the administration to consider additional factors in determining which attendance plan we operate under, within a DHEC designation of high. This would enable us to continue to remain under a Plan 2, which the administration, as well as the experts with which we consult, believe is safe under current conditions. Because I would remind you, the protocols for a 1 and a 2 are exactly the same. Going back to those tenets we talked about earlier. Maintaining 6 feet of social distancing, wearing of masks in transitions, and at other times when they might not be able to maintain 6 feet, frequently washing or sanitizing hands, having people stay home when they don't feel well. There is absolutely no protocol difference between a 1 and a 2. The difference is the number of students that our employees have responsibility for ensuring that they follow the protocols. They have demonstrated, both our students and our employees, a great ability to follow those protocols. And one of the reasons to start with a 1 was to ensure that students could become accustomed, employees could become accustomed, and the protocols would be followed with rigor and fidelity. The other factors that we would look at are the factors that we look at now, in addition to just the DHEC spread. We want to provide added weight to the 2-week new incidence rate. You know, that rating has 3 categories that we get from DHEC. You see them up there. New confirmed cases, positive cases, the 2-week incident rate, the 2-week trend, and the 2-week positive test. So the positive test right now is greatly driving the overall statistic. I believe one reason that may be is the overall number of tests in the last several weeks have declined. We theorize that that's the result of people either adopting on their own or it's being recommended to them. They don't go get tested unless they feel like they have some symptoms. So if you feel like you have symptoms, you'll get tested. I think there's a good likelihood that you're going to test positive, and I think that's borne out in the numbers. What we want to give a little extra weight to in looking at is the rate per 100,000. And you see there our rate per 100,000. Can you scroll that up where we can see the last number? Okay. While he's moving to that, it's the rate as of the 13th of September was 9.9%. Preceding week, you see, was 12.5, and you see 97 cases versus 151 the week before, and the number below that is 64, and the number below that is 79. So we want to look at that, not just as a part of the whole DHEC evaluation or metric, but in isolation and giving a little additional consideration to it. And again, considering the percent of positive test rate as a part of the 100,000, which is not up there as a column. In other words, us looking at that. Student and employee adherence to the protocols. Again, we've had great response. That has worked tremendously well. We're going to continue to look at that. And as we do now on a daily basis, look at the level of spread within schools. Now, right now, the most recent numbers that we have 73 employees who are out of work, either quarantined or exposed. Only 9 had an exposure at work. And in almost every one of those cases, it was unavoidable. They were dealing with a student in a particular situation, and they were inside that 15-minute window. We have 289 students who are either isolating or quarantining. As a reminder, isolating, you've tested positive. You've been diagnosed as having COVID-19. 34 are isolating. 255 are quarantining. So if you put that in perspective, those are very good numbers. Obviously, we don't want anybody to be sick. We don't want anybody to be exposed. But the exposures we are seeing are almost all, not all, but almost all, from outside the work setting, the school setting. And the majority of people we have excluded are for exposure. They're quarantined. They're not isolated. We closely monitor isolation and quarantine data on a school-by-school basis. That number of employees has been consistent at about 60 since school started. It's been consistently around that number. Now we track all of them, so this could include, some of those students might include students in the virtual program that their parents have notified us. We believe that we can assure our employees and our students and our families of the same degree of safety in a 2 that we have in a 1, based on our now multiple week experience with implementing protocols. I believe it's important, as I know all of you do, to have students physically present at school as frequently as they can be present. Safely present. Safely for them and safely for our employees. And as you all are well aware, there's a lot of information out there as to the severity of this. There is information that it is much less severe for younger people. There's also a greater risk for employees because of their age. And in some cases, underlying medical conditions, which some experts estimated well more than half of our population as a whole has underlying medical conditions. It is a particularly sobering note that we mourn the loss of 3 school district employees in the state of South Carolina within the last 2 weeks. That is even more reason for us to ensure that we move forward in a cautious manner. And we will never recommend to you, nor will we act in a way that does not place the safety and health of our employees and our students foremost in our considerations. We believe that at this point, this is the right thing to do. It maintains those protocols. It maintains the safety that we need to have for employees, for students, and ultimately for our community. Because if we have a large number of students present, and we have spread because we don't follow the protocols, that spread will not stop at the door of the school. That spread will follow them out into the community. I would also note, as we're talking about this, you all will recall from our plan, we have always had exceptions to the plan with individuals or small groups of students. One of the things that we continue to look at and work towards is increasing the number of days where we can do that and maintain the parameters we talked about, most especially maintain the 6 feet of social distancing. We currently have groups within the system looking at the possibility of returning, and I mentioned this to you all before, but as a reminder, of returning pre-K, K, 1, and possibly 2, second grade, to in-person 4 to 5 days a week if we can design a way in which to do that safely. The class sizes do not yet lend themselves to just decreeing that and doing it. There would have to be some modifications made, some changes made. For example, at pre-K and kindergarten, there'd be times of the day they would be with an aide and not with the teacher. We have a pilot group of 9 elementary principals looking at that right now. How we might safely do that to ensure the safety of those students, the teacher, the aide, and the greater school community. We're also looking at return to a greater frequency, 4 to 5 days, of some of our special education students. As you all know, we already have special ed students at Washington Center and West Greenville attending more than 2 days a week. We're looking at that. We have a group looking at that internally with special needs, and we also have a group looking at the return of career and technical students at the career centers, beginning with the level 2 students. Because of the small class size and the ability to hold the class within the shop areas, we only have a handful of classes that we're having to adapt logistically to try to bring them back because they don't have the social distancing space. So as we've talked about before, perhaps not as directly, specifically as that, we are working on those things and should be able to make some announcements about that within the next 10 days or so. Again, making certain that we do that in the manner that ensures the safety for all. Now again, that's not something we're asking you to act upon or approve today, because that's in accord with the exceptions we list in our plan already. What we're simply asking you to do today is to amend the attendance plan framework to allow the administration flexibility to utilize attendance plans 0, 1, or 2 within the DHEC overall designation of high. That's all that we request that you do. Would still leave us the ability at medium to be in a 1 or a 2, and at low to be in a 2 or a 5, assuming that the appropriate health protocols are in place. Be glad, Mrs. Lewandis-Wells, to answer any questions that board members might have, or anything that I might have inadvertently omitted that you need to know in order to make that decision.
So I have a recommended motion from the administration to amend the attendance plan framework to allow the administration flexibility to utilize attendance plan 0, 1, or 2 with the DHEC designation of high. And Mr. Sailors
Madam Chairman, I'd like to make that motion.
Second.
and Ms. Wells seconded. Are there questions? Any questions? I have a question then. Basically, what I'm hearing you say, Dr. Royster, is that DHEC regulations are calling for the social distancing. That's what is being required of us. Is that correct?
DHEC has not put that in regulation, but it is in their recommendation. And their recommendation, absent direction from any other public health entity, of which there is no other in our state. They are the state agency responsible for public health. And they have said to us the things that we have said to you. And that is 6 feet of social distancing, wearing a mask, frequently sanitizing your hands, staying at home if you are ill.
I also heard you say that you're looking at ways to increase the days of the week for students to re-enter into a basically traditional schedule.
Yes, ma'am. As we have been doing since we began this process, we are just now further along with that. For one thing, we had to make sure that what we put in place to protect people was in fact working the way it was intended to work, and I believe all the data supports that it is.
And you're looking to implement elementary special needs, special education students first in order to see how things progress?
I'm taking it that you had a comma in there, elementary, comma, special needs. You weren't defining just special needs at the elementary level.
No.
So I took it the right way then. Yes, elementary, special needs, pre-K through high school, career center year 2, which would be predominantly seniors in high school.
You're looking to proceed to 4 or 5 days?
Yes. Ideally 5.
Okay.
There are some specifics related to special education that we need to continue to discuss, where they have a requirement for inclusion.
Yes, sir.
Obviously, we won't have general ed students there on Friday, so we need to work through that, but I do not see there being an issue with having them there 5 days a week. They just would not be able to have that inclusion on Friday.
Okay. And,
Up to you.
okay, and also just want to make sure that I'm understanding that by the step-by-step progression, this assists food services, buses, and so forth to adapt to all of these changes and implications, or implementing it.
Yeah, I appreciate your question or your comment, because it really points out this is not simply a matter of opening the door and we've measured the room and they'll fit in there socially distanced. That's a part of it. In fact, it's a part to the level of we've sent someone from facilities out to all of our elementary schools to physically lay out each classroom at those levels that we're looking at, pre-K, K1. We're also looking at 2, more questionable at 2, to lay that out to see how many we can safely put in there. So they have to physically go out and touch those spaces, not just looking at the drawings, which they have digitally, because the drawings don't always reveal what was actually as built.